Who were those idiots? Who were the idiots in the federal government who decided that open enrollment for senior citizens on Medicare should be only from October 15 to December 7, as it was this year? I know that committee or office was led by idiots because no one who thinks rationally about Medicare could have decided on that ridiculous schedule. There are millions of seniors who must review their Medicare Part D prescription plan or their Medicare Part C Advantage plan during that period, or keep whatever they had from the previous year for another year. Did you ever notice that many seniors have difficulty hearing, seeing, reading, or understanding quickly? Well, that is even true with counseling them on which Medicare plans in their areas are good and available choices for them. The insurance agency where I have worked for over 22 years concentrates on helping senior citizens with health and some other insurances. When I started working there in 2003, the agency had only 2,000 senior citizen clients. Today, in 2024, this agency has over 22,000 senior citizen clients. Our firm has grown from one office with 3 agents and 3 staff to 5 offices with 12 insurance agents and 12 staff. This insurance agency grew because we studied Medicare insurance policies, laws, and regulations so that we could give senior citizens a great service. Also, if Medicare's medical billing is messed up or gets messed up so that it might hurt one of our senior citizen clients financially, we help the client to fight the messed up medical billing at no charge. That, with the great service of our agents, drew more and more clients to this insurance agency. Our insurance agency grew to be the biggest senior citizen services insurance agency in the state of Indiana, and one of the largest insurance agencies in the country. A successful insurance agency like this one should be consulted by the federal government on how much time it takes to help senior citizens through an open enrollment period. But we were not consulted by the federal government. As a result, for the Medicare open enrollment period, our employer bought lunch for all the employees every day so that we could not need to leave our offices during lunch times. Our agents had to see clients one right after the other from when the office opened until the office closed. We don't want to be rude or rushed towards any of our senior citizen clients. We want to give good service. But the short amount of time for Medicare open enrollment pushed us to be more brief with some clients than what we would want to be, simply because we tried to get through to them what the choices were, to give them as much of a good choice, a good pattern of choice, so that they could decide. The Medicare open enrollment period should be from September 12 to December 12 to allow insurance agents and agencies to treat senior citizens on Medicare in a more gracious and relaxed way. But when federal overseers set the time limit, they never consulted the more busy and successful insurance agencies that serve senior citizens on Medicare. So again, I ask, who were those idiots? That's my opinion. I'm Woodrow Wilcox.